Hello, everyone. On behalf of my research team, I welcome you all to our presentation on healthcare student and academic perspective of adapting to remote education. And today I'm presenting some data of a larger project we are all working on. So adaptability refers to the cognitive, behavioral, and emotional adjustments that individuals make to manage new, changing, and uncertain circumstances, conditions, and situations. It is a key requirement in all domains of work, life, and education when natural disasters or global crises cause significant and lasting disruptions, for instance, the COVID-19 pandemic. During the pandemic, universities across the world transitioned to remote education, most of which is through online delivery. Engaging with a curriculum that has been transitioned from in-person to remote education is likely to impact how students and educators adapt to the changes. So the approach to explore healthcare students and educators' educational experiences while adapting to remote education. And we chose 5 large courses in the Faculty of Medicine, Nursing, and Health Sciences at Monash University, including medicine, nursing and midwifery, biomedical science, physiotherapy, and health sciences of public health. Drawing on pragmatism, we employed a convergent mixed methods design. Quantitative data were collected via online surveys of students and academics during the semester 1 last year. Then we individual and group interviews conducted with selected students and academics to gain a deeper understanding of their experiences. The survey included a validated 9-item adaptability scale to measure their adaptability. And when responding to the items, we asked participants to reflect on the experiences they had during the remote education. In addition, participants were asked about their perceived preparedness for and interest in remote education. Using semi-structured interview protocol, we conducted 7 group interviews with 26 students and 17 individual interviews with academics. Sufficient information power achieved, and the data were analyzed using the team-based 5-stage framework analysis approach. Given the design and volume of data, our results are quite extensive, but for the time limit for this presentation, I'll only focus on the key findings. So you can see that the demographics of our participants, they are quite diverse. I'm not talking much about that. So 2/3 of the students reported that they did not have any experience of remote education prior to the pandemic, whereas almost half of the academics had previous experiences of providing remote education. The adaptability scale yielded a higher score for academics, indicating their higher adaptability to remote education than students. Neither students nor academics seemed prepared for remote education, leaving the mean score less than 3 for both groups. Students' interest in remote education also seemed relatively low, whereas academics were significantly more interested in remote education. A strong positive correlation found between participants' adaptability scores and their preparedness and interest in remote education. Subgroup analysis showed that for both students and academics, their adaptability did not differ statistically for demographics, for instance, gender, disciplines, nor any previous experience of remote education. Qualitative data identified 4 themes representing the educational experiences students and educators had while adapting to remote education, and I'll go through each of them briefly. The major concern educators and students expressed in adapting to remote education was limited social learning. They observed the loss of nonverbal body language cues, artificial and impersonal interactions, limited conversation, weaker rapport, and little peer-to-peer debate and discussion that diminished the value of deep learning. Adapting to remote education required educators to change their teaching philosophy. They reported the loss of being organic and responsive in teaching remotely that is naturally fostered in the face-to-face environment. This prompted them to shift to more didactic pedagogy, given their limited knowledge of making online lessons engaging that affected their satisfaction with teaching and adaptability experience to remote education. Remote education meant a lack of hands-on learning opportunities and social learning for students, resulting in limited clinical and practical skills, as well as transferable skills like communication, teamwork, and critical thinking. Both students and educators viewed the critical importance of a positive attitude to changes and viewed remote education as an opportunity to learn and grow to adapt to future changes. So the qual and quant data together showed that students were less adaptable than educators, and while remote learning was less appealing, some adapted well to it using their adaptation mechanisms. Participants' description of the remote education experiences could mostly be seen unsatisfying. For instance, limited social learning, transmissive pedagogical focus, and lack of clinical and transferable skills development. These findings prompted us to question the effectiveness of remote education to prepare healthcare students for practice. Navigating the challenges associated with remote education provided students and educators with a unique opportunity to improve their adaptability, which is an attribute more readily viewed in the face of future uncertainties. And since adaptability is a sought after skill for workplace, so its promotion may mean that students are graduated with higher adaptability to cope better with uncertainties with the future world of work. And I'd like to thank the research participants and the faculty for their support.